It's been an exciting week since our last video update, and one of the things that's changed is that FHN has had its first COVID-19 positive inpatient. The patient was in her 50s and was admitted for a brief period of time. This allowed our team the opportunity to be able to go through an actual response with a real patient, and it really was able to demonstrate how well prepared that they are through their training, through the preparation that was done. And we feel very comfortable that we're ready to handle and care for any other patient that is positive COVID-19 with not only professional care but also empathetic care. Caring for a patient with COVID-19, as aside from other patients, is the isolation precautions that people are talking a lot about. However, healthcare workers have been working with patients with isolation, whether it was for respiratory conditions or viruses for their safety, for many years, and the care of a COVID-19 patient is very similar to that. We're just taking extra special care to make sure that none of those droplets or none of that infection is able to spread throughout our facility. We want to make sure we keep that really well controlled. So Stephenson County at the time of this recording has had 2 positive COVID-19 patients, which isn't a lot, but it truly hits home that it is here and that it can impact all of us. The mobile testing has been well utilized. It's going very well as far as our processes and the techniques that are being done. It's become really efficient, and it's allowed us to, again, to allow for social distancing, keeping high-risk patients potentially safe from interacting with one another, and been very convenient. So that's worked out well. The key is that people really do need that appointment before they can have the testing done. So they need to complete the screening, have an appointment based on that screening, and that's allowed the flow to be as smooth as it has been. Another recent development is this week we were able to put on our website an online screening tool. This online screening tool allows people to put in information about their age, their health history, and any symptoms that they may be having. It uses a chatbot to be able to develop an algorithm to direct them to what kind of care they may or may not need. It's easily accessible and it's free, and it's available on our website at www.fhn.org, and we've already found the community members using it, so we're seeing some good use of that free online tool. FHN, once again, is doing daily counts of the amount of personal protective equipment that we have. Fortunately, we've received some small orders of additional inventory in, and to know whether we truly have enough is going to depend on how many patients and how many people come in positive with COVID-19 and what our utilization would be. Another good news note is many of the factories in China are starting to ramp up production again, where a lot of these supplies are coming from. And what that allows is for inventory to be released. However, it'll probably be a few week delay before we're able to see that. And of course, being high demand across the globe, we certainly may not get full orders, but we're watching our personal protective equipment closely and making sure that we're conserving it for the time that we would need it. The tent that's gone up in the FHN parking lot is part of our response and preparedness plans. Currently, we're looking at utilizing it for testing. So once again, we can take people that are suspected or have COVID-19 type symptoms that need to be tested and have them in an area that's protected as well as away from some of our other high traffic areas, so to protect the general population. And so we're going to utilize the tent in that fashion, and it's something that we could also utilize if there was a surge, that we could do triage, or we could do some medical screenings within that tent as well. So it's really there just in case we need it. It's one of those things that we'd rather be prepared and not have to use it than be in a situation of where we need to request additional resources. So right now it's there just in case. FHN has asked patients to reschedule procedures that can be deferred until later in the year. We've done that with the consultation of their physicians and providers to make a well-informed choice of whether that procedure is really necessary now or it can wait for some time. If it was something that was urgent to help the patient, then of course we're going to move forward in the best interest of the patient at this time. However, any elective or non-urgent or general wellness type of procedures, we've asked to reschedule to a time that we're more comfortable that we can be prepared to handle any additional volume as well as resume our normal day-to-day functions. I think it's going to be difficult to tell whether there's going to be a surge. We certainly know that there's going to be increased activity and that we will see more positive patients. When we talk about a surge is really something that goes beyond our existing capabilities to be able to handle. And I'm hopeful that we will be able to handle whatever comes through our doors within our existing resources and not beyond that. But of course, that depends on all of us doing the things that we need to do, such as our social distancing, washing our hands, keeping safe, and following the instructions that are being put out there by our local officials. This is certainly a stressful time for many people and a time of high anxiety. What's important is that we stay future focused and we remain positive. This is only a moment in time and we will all get through this. We're a very resilient nation and I see this as being no different from that. We've actually had an interview with our Assistant Vice President of Behavioral Health, Gabriel Gonzalez, and that's available on our website for anybody who'd like to listen to it about the importance of mental health. It's also important for us to reach out to one another virtually at this time and make sure that there's good communication and contact and that we are truly supporting one another, focusing on what are the positive things that we're going to do once we get through this. The staff and providers at FHN are doing incredibly well. Despite the same stresses and anxieties that anybody else would feel, they are upbeat and well prepared and ready to meet this challenge for our community. They are committed, compassionate, and ready to serve anybody's needs. I'm just so incredibly proud of the team here at FHN, looking to always put others before themselves. They truly are our greatest resource. The strength of living in Northwest Illinois is really our community. And so many community members who want to help, we've set up a donation page on our website that they can donate to. It's the COVID-19 donation. They can also drop off materials such as hand sanitizer, homemade surgical masks at the hospital during specified times, and that's listed on our website. And we would be able to collect that material, inspect it, and to distribute it and utilize it however it's needed. We're also, a kind word goes a long way. So any kind of positive encouragement that the community can share about our healthcare workers, or even thank a healthcare worker if they're in your family or you know them, it does help us and it's greatly appreciated. We're working on some current social media campaign to help to show that community support and demonstrate how strong we are together. So stay tuned for coming options on that.